There's no doubt it's dangerous, but just how concerning is the India variant of COVID-19? The World Health Organization has already declared the strain a global concern and is set to release more information in the next few hours. The virus has already spread beyond India's borders to dozens of countries.
Another COVID-19 strain has been elevated to a variant of global concern. The fast-spreading mutation was first found in India last year, and it's believed to be what's fueling the surge in the country.
There is some available information to suggest increased transmissibility of B.1.617, and as such, we are classifying this as a variant of concern at the global level.
3 other strains from Britain, South Africa, and Brazil have already been given the same classification. But preliminary studies show the India variant spreads more easily than the others. It's already spilled beyond borders to more than 30 countries, with the Philippines the latest to report infections.
The spread of variants, increased social mixing, the relaxation of public health and social measures, and inequitable vaccination are all driving transmission.
Experts are still studying how infectious the variant is and whether it is responsible for India's crisis. Also in focus, whether the strain might be resistant to vaccines.
What we know now is that the vaccines work, the diagnostics work, the same treatments that are used for the regular virus work, so there's really no need to change any of those.
At least 15 places have already blocked travel from India in a bid to curb the spread.
At the same time, the coronavirus continues its march across India. There have been nearly 3,900 deaths and 330,000 infections in the past 24 hours. Neha Punia joins us for more. Neha, is the WHO's warning on the variant raising concerns in India or changing the government's response in any way?
Well, there are concerns and criticisms, Steve, over how the Indian government has dealt in particular with this variant. You had the news of this variant first surfacing last year, but it was only in the first half of 2021 that genome sequencing was done on about 300 samples. And back then, India had identified this double mutant strain first. But it was only last week that the Indian government said that there seems to be some sort of link between the surge in some cases and the B.1.617 variant. But even now, the government has, pointed out India's increasing recovery rate. It's talking about how there are early trends in terms of how cases seem to be dipping in some regions. And, it has not announced any change in policy, despite what the WHO has now announced, labeling this particular variant a variant of concern. India still hasn't done that. You have instead, the government talking about how, yes, younger people seem to be worse off this time around compared to the first wave of the pandemic. You have experts who pointed out that clearly this catastrophic rise in cases in the last month and a half is linked to this particular variant. But the problem is that India does not have enough information at hand. It's not doing enough genome sequencing. It's testing only 1% of its samples. And experts have told me it's like fighting this particular virus with your eyes shut. You don't know what you're up against. The other concern, of course, is India's very poor vaccination uptake. The country is only fully vaccinated about 2% of its population. And the worry is that with coverage so poor, so unequal, these variants will continue to mutate and continue to pose a risk to large sections of India's population.
And Neha, more international aid has been sent, but hospitals are still very much struggling from the sounds of it.
Absolutely. We have seen how this shortage started playing out about 2 weeks ago. And it was Delhi where the shortage was the most acute, the national capital, still to a large extent struggling to access beds, residents still being forced to scramble and sort out these necessities for themselves. While the situation on the oxygen shortage front here in the national capital has improved over the last few days, we're now seeing similar SOS messages coming from other parts of the country. In the last 24 24 hours, you've had 11 people die of oxygen shortages in a South Indian state. Similarly, in Goa, we're hearing from local media reports 20 people have died in the last 24 hours as well. And what was essentially a problem limited to large cities with better healthcare infrastructure is now playing out in smaller towns in rural India as well. And we've seen how in the last 1 month, since April, there's been a tenfold increase in the deaths that India has reported from COVID-19. Many of these deaths now coming from smaller states like Haryana, Uttarakhand, as well as Jharkhand in central India. And these are states that are reporting more than 100 COVID-19 deaths every single day. And this is just the official figures we're talking about. For weeks now, experts have been cautioning it's quite likely India's actual COVID-19 death toll may be 5 to 6 times higher, if not more. We've seen how crematoriums have been struggling to cope with the influx of bodies. In many states, including Uttar Pradesh, there are reports now of dead bodies floating on the river Ganges, with locals saying because wood for cremations is running out, many of these bodies are being disposed like that. So there is a huge concern that this problem that was so far limited to urban areas of India is now going to, has already reached, beg your pardon, less developed parts of the country. And dealing with this outbreak there is going to be that much more difficult.
Thanks for getting us up to speed. Neha Punya speaking to us from New Delhi.